For this project for the N620 technology class, we were asked a question about where we thought there was a deficit that needed nursing education. It took me a little while to think about this question, as I think there are quite a few areas that could be improved on, but I mostly narrowed it down to actively listening to your patient. I think listening to your patient is probably one of the most important things a nurse or physician or a doctor can do, and just truly listening to your patient. I know I have had several experiences where I felt like my nurse practitioner or my specialist was not listening to me, and I've actually changed doctors several times because I felt like they were not taking into account what mattered to me. So I think that's a huge thing, is that when you actively listen, not only are you trying to find out what might be wrong with the patient, but you are also trying to figure out what matters truly to them. And I think that makes a big impact on the patient. I think that creates a very, strong bond with your patient, shows you care, you truly care for your patient, and that you're not just going by a checklist. I know, nurses are busy, doctors are busy, but when it comes down to it, I feel like that is one thing that you should show, is to be actively listening to your patient, repeating back what they are saying, so that way you understand what matters to them, and I think that helps you make a care plan from there, depending on what the situation is, or what the patient wants at that point. I wanted to mention a situation with my grandma, actually, which this has been a couple years ago. She is counts as depression. She has several issues of being diabetic, high blood pressure. She sees a counselor every once in a while. She said some pretty dramatic things happened in her lifetime while she needed a knee replacement. And on the medication bottle, it had said that to take the opioid, the pain medication, as needed with her pain. Well, to my grandma, as needed, she took it as take it, every time she was feeling some pain, which became a huge issue because she was taking way more than what she needed. We ended up having to go to a prompt care because she was not going to go to the emergency room. And when they pull up her file, obviously it does not look good that she's on all this medication, and she's on a depression medication. My mom actually has a master's in substance and alcohol abuse, so she kind of knows the signs and symptoms. So we knew that my grandma was taking too much. But when we went into prompt care, the nurse went by the checklist of your symptoms, even though we kind of already knew what was going on. And then it turned up into being this huge, scenario, per se. And one thing that had just aggravated us is that they were not listening to what we were saying. And this became I think the main reason why I had picked actively listening. Like I said, I've had my own personal conflicts with specialists when I tell them what's going on or what's been tried, and I tell them what tests that I want done, and I just feel like they're not truly listening to my concerns or what I need, or what I think I need. So I think that is my main deficit in nursing for me, is that I feel like we need more education on this to be more active listeners, because this is something that has to be taught. It's not something that I think is so much learned, because we are learned to multitask as nurses in so many different areas. And I think actively listening to your patient when it comes time There needs to be education to put all things aside, all your thoughts aside, and all electronics aside, and to truly just sit down and listen to your patient. I think this creates a very healthy, um, caring, respectful bond between you and your patient. Thanks.